Every 40 seconds, somebody has a heart attack in America. 1,000 people a day. This is the worst statistic. Drop dead suddenly. That's called SCD, sudden cardiac death. Almost all of them have bad blockage. Many of them had no clue.
I get all my patients to do the $100 calcium score. There's no reason not to do this test. People should know that they are creating damage to their vascular system through their diet, through the inflammation, through high blood pressure, in fact, just stress as well. All of these factors damage your endothelium, which is a very thin layer. It's a one cell layer thick, right, of the inside of your blood vessels. Once that gets damaged, the cholesterol comes in trying to heal it, and that's what creates plaque. But also, it just reduces blood flow in general to your entire body. Hello, Dr. Kahn. How are you today?
I am so excited and honored you to have me on. Thanks so much.
This is a massive honor for me. Like I just shared with you a little bit ago, I read your book cover to cover twice when I was going through my own health journey. It was absolutely transformative. So I feel like I'm talking to a guru of mine, and I'm so excited to have this conversation with you. What really drew me to you, Dr. Kahn, is number one, cardiac disease, as we all know. Most of us will die of some sort of cardiac issue. And the way we treat this in Western medicine right now is really, we're just covering up the symptoms with medications, and your approach is completely different. And I would love to hear from you, Dr. Kahn, a little bit about you and how you came up with this approach. And you're a trendsetter in this. I mean, a lot of cardiologists probably disagreed with you when you first wrote your book.
Well, it's kind of you. I mean, very quickly, there were two paths in my life that led to my current role as an aggressive preventive cardiologist. I'm not a passive one. One was I grew up in a home where we kept kosher. So I always had to think before I ate. Was it okay? Was it not okay? Was my mother watching and I was going to get my mouth washed out with soap because I had bacon or something? No, she's a wonderful woman, still alive. But when I got to University of Michigan, I wanted to keep honoring that faith. And there was a giant salad bar. So I'm in my 48th year of being completely vegan. I mean, I have not had egg, cheese, poultry, meat. I don't judge anybody. You eat the diet that works for you. Unless you're a heart patient, I got to get 2 minutes in and give you my piece. But that's my little bit. And then number two, I knew I wanted to be a cardiologist when I was 10 years old. I had a murmur. I went to a pediatric cardiologist. I got into med school when I was 18. And on my path, and I graduated in 1990 as a big shot interventional cardiologist, came back to Michigan. I did my training out of state. And I was cracking plaque and busting up clots and treating heart attacks. But 3 weeks later, Dean Ornish's famous paper, The Lifestyle Heart Trial, was published July 21, 1990 in Lancet. And it came to my mailbox and I read it. And I said, I've never talked to a patient about nutrition because there really wasn't. I had not heard of Nathan Pritikin at that point. I didn't know about some other pioneers in the back because there's others. And I just started sharing that article, and then he wrote a book, and, then we got some resources like John Robbins, A Diet for a New America, and Caldwell Esselstyn at the Cleveland Clinic appeared on the location, and I visited the Pritikin Center. So I was sort of combining nutrition and holistic and aggressive cath work. And about 13 years ago, I said, enough of the cath work. I have stood next to an x-ray machine for hours and hours a week. And it came out of it, as far as I can tell, still healthy. I got a few natural killer cells left in me, thank goodness. But not many, but a few. But I went back to A4M, one of the big, integrated medicine programs, and did the whole functional medicine thing. And it's been 10 years of really, I joke with people, my hobby is reading literature. And I don't say this to be pompous. I'm so grooved on trying to figure out atherosclerosis and, pharmaceutical pathways when needed, natural pathways when needed, trying to explain to my patients and the public. So I write books, I do a podcast, but mainly I see a lot of patients, Detroit, Florida, and about 20 states, including your beautiful California. I got a bunch of patients in Malibu. We just telemedicine and all. But, I think what you introduced it, I just always got to shout this. Every 34 seconds, somebody dies in America of heart disease.
Right.
Every 40 seconds, somebody has a heart attack in America. 1,000 people a day. This is the worst statistic. Drop dead suddenly. That's called SCD, sudden cardiac death. Almost all of them have bad blockage. Many of them had no clue they had bad blockage. They didn't hug anybody goodbye. They die in the toilet. They die in bed. They walk out of the gym. They die in their car. They die at the football stadium. We resuscitate less than 10% of people, even in the hospital. You've got a defibrillator right there, but it just doesn't work well. So the only answer is start at age 15, 18, 20, 25, identify people and institute, hopefully with the new, administration and Bobby Kennedy, we may actually, bring health up to where it belongs. And I hope cardiac health, because I don't hear much out of Washington about cardiac health, but it's a move forward. And, so I am more fired up to talk about what we're talking about right now and what you read about in that first book of mine. So thank you.
Yeah, no, this is such an incredible time we live in. But I just want to highlight 10 years ago when I read your book, you kind of opened my eyes to the multifactorial nature of cardiac disease. And what I mean by that is I was taught in medical school. I graduated medical school back in 95, and I was taught in medical school that really cardiac disease was due to cholesterol. And high levels of cholesterol cause atherosclerosis, and that's it. And that's why we go after cholesterol. And your book really opened my eyes to, no, cholesterol is one piece of a big problem. And I'd love for you to unpack that a little bit, because I don't think a lot of people know this. Definitely, I have a lot of family members that are cardiologists, invasive cardiologists, doing stents still. And when I talk to them about your book, this is in 2025. Doctors still practice medicine, including my family members, not recognizing that it's more than just cholesterol. Yeah. So I'd love for you to unpack that for the audience. And
I love your last term, because I'm not a cholesterol denier. I think in some people, cholesterol, lifestyle-induced, environment-induced, or genetically induced, kills them. I've got so many examples of that in my practice, not necessarily dead, but documented severe disease. But there's so many exceptions to the rule. I just got to share with you, just a moment ago, a trauma surgeon left my office, patient. I'm going to fold this over so there's no chance to see her name. Her cholesterol is 275, her LDL is 200, and her lipoprotein little a, genetic cholesterol, is 337. These are very high numbers. So her apolipoprotein B is 150. And she had a calcium score of 0, but she wasn't satisfied. She had a carotid. She wasn't satisfied it was clean. So she got the famous Clearly CT AI study. She's one of the 4 people in my practice out of 1,000 who've had Clearlys. She doesn't have 1 drop of plaque. So this doesn't deny that cholesterol doesn't matter, because I can show you, 90 other people. But how does this happen? She eats healthy and she's thin and she exercises and she's had a negative sleep study and all. But how does this happen? And, that's what keeps me reading medical journals. I think there's something to the argument that if you're vitamin C deficient, you have more fragile arteries. This was a Linus Pauling PhD theory. Right. And if your diet or your supplements are vitamin C replete, and I take personally about 10 grams a day of vitamin C. I'm like an old Linus Pauling guy. I take it as powders or tablets, and I eat a lot of vitamin C-rich food. You may actually have bulletproof arteries, but never trust your labs. You've got to do cardiac imaging, which we'll talk about. But so really quickly, because we limit time, 1961, I love reading the original article, the Framingham study, everybody's scratching their head. Are heart attacks just age, or can we identify risk factors? 1961, they identified hypertension, high cholesterol, and LVH on the EKG, left ventricular hypertrophy, which is why people should ask their primary care doc for an EKG, even though Medicare won't cover it. Just ask for one. So an abnormal EKG, hypertension, high cholesterol. Then they added on diabetes a few years later. Then they added on smoking. Then they added on family history. Mom, dad, brother, sister had an early heart attack. And still to this day, that's the only framework
Right.
that most internal medicine, primary care, and cardiologists operate on a 1961 framework. I think it's still accurate. But let's talk about 20 more. I just mentioned one, lipoprotein little a, or the 6 tests you can get about inflammation of your vascular supply, or your homocysteine methylation pathway, or your omega-3 and your vitamin D. Genetics, we can check APOE and a obscure gene called 9p21. We can do more. Air pollution, environmental toxins. It's really a complex formula, and we don't have that calculator. We have American Heart Association calculators. They don't even include lipoprotein little a, even though 25% of people inherit a genetic cholesterol that can be very dangerous for them, or not, as this doctor I just showed you. So I think it's so interesting to, open your mind to all the possibilities. But when I see one patient, I have to look at their arteries. I've got to either look at their carotids with an ultrasound or do a simple $100 calcium CT scan. This surgeon came back zero, unbelievably. Or really, if you want to up the game, as you know, you can bring state-of-the-art AI technology and do a CT angiogram with some iodine dye. And there's no better test in the world than what I just showed you. I mean, this woman is just bulletproof, but I never would have sent her out of my office. I didn't put her on prescription drugs. She has no atherosclerosis. Healthy lifestyle and some supplements. So it's so fascinating that atherosclerosis, we've got a new one called TMAO. If you're taking choline or carnitine or eating a lot of egg yolk or red meat, check your blood, Quest LabCorp for TMAO. I had a lady today. TMAO level should be less than 6. It was 95, one of the highest.
Wow.
And I asked her, she goes, I'm taking 4 grams a day of carnitine for energy, which is a reasonable choice, but TMAO may damage your endothelium and your kidneys. So we're going to have to come up with some compromise. So we're learning, all the time, new pathways. I just learned today that Fosamax is a mitochondrial toxin. There was a new paper. It inhibits your body's ability to make CoQ10. And, put Fosamax on the list, an osteoporosis drug that many people know about as a potential new factor, along with other drugs like proton pump inhibitors.
Right. Yeah. So, you bring up a really important point, I think, is like we've practiced medicine for so long, having to use risk factors to determine what is our risk of disease. So then we determine our therapy based on that, because it's impractical really to do an angiogram on everybody, an invasive angiogram to discover disease proactively. We have the calcium score, but for whatever reason, it's kind of buried in medicine because insurance doesn't cover it for some reason. I get all my patients to do the $100 calcium score. It's just, there's no reason not to do this test. But now we're at this new age where we have this Clearly test, and we can, for a very quick CAT scan of your heart, even though insurance won't cover it for everybody, we can get with high resolution a really good idea of what's actually going on with the coronary blood vessels, right? And so what's mind-blowing to me, and that patient of yours just blows my mind, a trauma surgeon with an LPA of 300 and no cardiac disease. It just shows you that, unless you really take a look, it's hard to know what's truly happening just based on risk factors. And so do you think that we're going to get to a world where the coronary calcium score AI scan is part of just a normal workup of everybody?
We should have been there 20 years ago. I mean, this $100 calcium score, it used to be $1,000, but because of simplicity of imaging, it's now $100 or less. It's free in Cleveland. Just go to University Hospital. That's been around since 1990 and widely available since the year 2000. And yet, my own estimate, less than 5% of primary care docs added to the list. If the U.S. Services Preventive Task Force says do it, people will do it. Now, they aren't that innovative and creative. And then secondarily, it comes back abnormal. And where's the protocol? Where's the double-blind randomized studies, which sorely or sadly, we don't have that many. I certainly have my own protocol, what to do with a high calcium score. I've written articles about it. I'm writing a new book that will go over that, but it's not a set protocol. Aspirin and statin would be the standard knee jerk from a cardiologist, maybe a stress test. In my mind, you go ahead and you get the Clearly CT angiogram if you have disease and you define it all. So we should have had mammogram or thermogram, colonoscopy or Cologuard, and calcium score 20 years ago. And I don't know anybody in Washington pushing that agenda. If anybody's going to watch this, hi, Bobby Kennedy, I'll talk to you anytime. I have given him my books when he was campaigning in Michigan a couple of months ago before the election, but whether he read them or not, I don't know. So it is time for that.
Yeah.
Now, there are those that argue, skip the calcium score, $100, no IV, no allergy potential from iodine. Go right to a $1,600, Ferrari test called a clearly AI CT angiogram. And of course, clinics like yours and some of the others make that widely available. And I do too, but I don't think, we're ever going to win the battle of that becoming routine yet. It's just too big a test and too expensive. And you got to prepare a patient with beta blockers.
Right.
You know the routine. So my own protocol is if your calcium score is 0, very rarely do I think you need to step ahead. This surgeon really said, I don't believe it. I want to know my soft plaque. And there's a lot of soft plaque out there, but the prognosis for 10 years with a calcium score of 0, risk heart attack, is very close to 0. So, if you'll take care of your lifestyle, some people get that calcium score 0, the good result, and say, great, cheeseburgers, French fries, and Coca-Cola. No, if you'll take that and say, by the grace of God, I'm not aging aggressively, and throw in lifestyle, you'll probably end up in good shape. So it's, people are doing True Age and all these other aging tests. There's some pretty good literature. If you get that heart CT scan and it's 0, you've got healthier brain, healthier kidneys, low cancer risk. It's a very good metabolic marker for the whole body network.
Yeah, absolutely. I mean, obviously, if you have cardiac vessel disease, you might have vessel disease elsewhere as well, and so it's an indicator of just overall the status of your circulatory system. So,
and just on that note, not to interrupt you, but if a guy is listening to this, or a partner of a guy is listening to this, if a guy has erectile dysfunction, they have to get a calcium score at least. And I just read literally a 240-page guideline by the European Urology Society on andrology, on sexuality. And on page 240, last line, consider a cardiology evaluation for a man with erectile dysfunction. I knew it had to be in there. It couldn't have been buried deeper in the article. I really thought by now, this is also a 25-year-old concept. A man with erectile dysfunction has vascular disease to proven otherwise, and below the waist and above the waist are related. So don't let them die of a heart attack just because you gave them, tadalafil or sildenafil. Check the heart. It's so important, and it's so available.
Absolutely. And you bring up a really important point there, which is something that I'm talking a lot about now with my patients. It's not just about the status of the blood vessels in your heart. It's really the status of the blood vessels of your entire body. What is the status of your vascular system and also your microvasculature? Because the more I think about it, the more I feel that it's really the damage that we're doing to our vascular system that way precedes any type of heart attack, stroke, kidney disease, to your point, erectile dysfunction. It's the vascular system damage that we're doing from a very young age that creates these problems later on in life, even Alzheimer's disease, I feel. So maybe it sounds like your next book is going to talk a lot about the vascular system. And I'd love to hear some previews there. How do we think about this?
You probably know Daniel Amen, the famous psychiatrist, who said psychiatrists are the only specialty that treat an organ they never see. So he developed brain imaging. And really, we can do some good imaging nowadays. But, it all starts in that lining, the endothelium. We can't see the endothelium. I mean, so we really are limited. And then we now know there's a mucousy layer on the endothelium in every artery in the body, 50,000 miles, called the glycocalyx. And there is one very bizarre instrument you could put under the tongue and try and image little capillaries and measure the glycocalyx in research studies. But basically, we got so much left to learn. And you're right, if we're going to pick up disease super early, we either need a blood test or an imaging study that's even earlier than a calcium score of 0. But for the meantime, that's clearly the best substitute, or a good quality carotid ultrasound, which is widely available. I'm not a big fan of lifeline screening. I don't think they're the perfect answer, but, they do pick up some disease in asymptomatic people. What you're doing picks up more at Next Health, of course.
Yeah, I think about the vascular system, and very rarely is this talked about in primary care medicine. And so it's because there isn't a great way to evaluate it, to your point, right? But I think people should know that they are creating damage to their vascular system through their diet, through the inflammation, through high blood pressure, in fact, just stress as well. All of these factors damage your endothelium, which is a very thin layer. It's a one cell layer thick, right, of the inside of your blood vessels. Once that gets damaged, the cholesterol comes in trying to heal it, and that's what creates plaque. But also, it just reduces blood flow in general to your entire body. How are people damaging their endothelium besides some of the things I mentioned?
Yeah, well, obviously about 10% of America still smokes. I had a young man today who vapes 5 times a day. Nicotine, I mean, that's no better than smoking based on all the data. And lately we've gotten some data that smoking cannabis is, damaging arteries. So that's no longer put in a benign column. Sedentary lifestyle versus active lifestyle. Probably a high saturated fat diet. There's pretty clear data. Both damages your gut and gives you the opportunity to develop some leaky gut and endotoxin into your blood, but it probably damages your endothelium, at least transiently. There's some, one big milkshake, and you can check blood flow in the forearm in research studies. One big cheeseburger, a famous study by a cardiologist in Colorado, one cheeseburger literally damages both your sexual response and your endothelial function. So, diet's a factor. And again, animal-based saturated fat is probably the most suspicious of all. All the toxins in the world, all the endocrine disruptors. There was a paper 2 weeks ago that 350,000 people a year in the world die of phthalate exposure, which is in plastics and PVCs, but it's also in ladies' perfumes and Glade air fresheners, and they are endocrine disruptors. And it was calculated 350,000 people a year in the world die due to phthalates, and then put in PFAS and PFAS. So air pollution triggers endothelial dysfunction. If you're living in Mumbai or you're living in southern Detroit where the factories are, you better get a home air filter. There's no easy solution to it. If you work around trucks and exhaust, it's not a benign thing. And it's amazing how much data there is for air pollution now. Pesticides, herbicides, the whole environmental picture plays. Obviously, elevated blood sugar. What's rarely talked about is advanced glycation end products. I'm like a geek on this topic.
Let's talk about that.
30 or 40 years of science that there's 2 ways that you can alter proteins and fats predominantly in the body and make your nerves work poorly, make your blood vessels work poorly, raise your risk of cancer, heart disease, dementia, kidney disease. And they're called advanced glycation end products, which is abbreviated AGEs. Kind of cool because they do age you rapidly. And there's 2 ways your body accumulates lots of AGEs. One is running a high blood sugar. So the type 3 diabetes of Alzheimer's is just another way of saying increased exposure to this chemical reaction, this non-enzymatic chemical reaction called advanced glycation end products. Wear your CGM or get your hemoglobin A1C and your fasting insulin, but check very carefully that you're not insulin resistant and hyperglycemic. But the other way that's so cool is you take a breast of chicken, which I don't eat, but I'm not going to make a judgment, and you put it in a tagine or a Instant Pot, a pressure cooker, and you cook it moist. You make almost none of these advanced glycation end products. You take the chicken and throw it on the barbecue. You take the chicken and you put it on a George Foreman grill or you roast it, and you create an enormous, it's a chemical reaction called the Maillard reaction. So you take meat and you grill it. You take chicken and you grill it. Even if you take tofu, it has to be high fat, high protein foods that you dry cook. How popular right now are dry steaks? These are actually the worst food in the world, no judgment, is when you fry bacon, you create more advanced glycation end products. And you can actually calculate this. A researcher in New York who's the queen of this, Helen Vlasero, recently retired, maybe 200 publications on this. She has lists of food by food by food, how much advanced glycation and how you cook it. So moist cooking, if you're going to cook chicken on the barbecue, marinate your chicken actually in lemon, vinegar, and brown beer. Those three things
Wow.
prevent this chemical reaction to a large degree. If you just put the dry steak on the barbecue, God bless you, don't do it too often, or take a vitamin called benfotiamine, which is a version of thiamine. It helps
Hmm.
prevent that reaction. So cool stuff. But we
Interesting.
don't talk about such a simple kitchen approach to better health. Anybody just go read on the topic because there's extensive literature. It actually causes aging and wrinkles. So I
Right.
read more about advanced glycation end products in women magazine articles that just show up on my Google, feed than
Yeah.
I read in, cardiology texts. But it's very much a cardiology topic.
That's so interesting because my perception of advanced glycation end products is something that we create with high sugar levels inside of our bloodstream. But you're saying you actually create these and ingest them in the
Yeah.
foods that we're eating as well. And the cooking of the food,
It's
the
a
method of cooking.
particularly.
Oh, that's a great tip for people. I don't think anyone would have even thought of that unless they've read some of your work. So thank you for that. What are some of the other things that people can do to rehab their blood vessels? Say they have endothelial damage. Other than the things that you mentioned, avoiding all these potential toxins to our blood vessels, how can we treat them and rehab our glycocalyx and our endothelium?
Great question. So, I mean, such an obvious thing, but I insist people own a home blood pressure cuff. There's lots of wearables. There's basically no wearable blood pressure item right
Right.
now. There is one in England. It's not FDA approved. You can't download the app. I own it. It's a bracelet, but I can't use
Me
it
too.
because the app is shut off in the United States. By next
I
year,
have the
Yeah.
I think they'll have the founder came on my podcast as well for
I think I
Actia.
heard him. Right, exactly.
Yes,
And that's going to be a
incredible device.
breakthrough, or maybe they'll sell to Apple or they'll sell to, Whoop or Fitbit. Because, if you can't do it in the meantime, spend $90 and make it a ritual, make it blood pressure Sunday. And just so you can rehab your endothelium by identifying you're running 150 over 90, not 110 over 70, and, working on it through multiple ways. Number two, avoid some of the toxins, avoid the advanced glycation end products. Make sure I'm not, diet judgmental, but eat whole grain, eat fruits and vegetables. We know that the polyphenols in brightly colored foods and all are very
Mhm.
endothelial friendly. I'm a supplement guy. Coenzyme Q10 is, I think, is a universal supplement for everybody. And it is clearly an endothelial restorative supplement that's so safe and very research based. I think vitamin C falls in the same, very inexpensive, endothelial friendly, antioxidant, anti-inflammatory. And of course, you could keep going with nitric oxide supportive supplements, whether they be beetroot or arginine or citrulline and all. Although I don't think we should depend, solely on supplements, but there are. The glycocalyx right now, the only thing that's out there, there's a couple supplements that are seaweed based, interesting.
Oh,
Green seaweed, monostroma is the name of the seaweed. They're quite popular right now in the integrative world. I can shout out a brand name. I don't, have a real tie,
please.
but Arterosil,
Arteriosil, yes.
Arterosil is a seaweed-based supplement. And I
Okay.
give the company credit, Calroy, because they do research. And
They
it's
do.
not, routine to see a supplement company do research. And
Right.
if you have a intact glycocalyx that helps you have an intact endothelium, maybe that's why the trauma surgeon's walking around. We talked about that with such beautiful arteries, despite a lot of
Yeah.
potential toxins in her blood. Fitness, HIIT training have all been shown. There's been data that HIIT training particularly can help shrink soft plaque. Hopefully you don't develop plaque, but most of us get some. HIIT training a couple times a week can help shrink plaque. All exercise is good, but HIIT training as part of it may be a super good idea.
Yes.
Don't smoke. I mean, it's I didn't mention sleep. Sleep has come on in cardiology, like a storm. And the data that sleeping less than 5 hours a night increases your coronary calcification, increases soft plaque, raises your risk of all cardiac events, including for sure atrial fibrillation. Are you not sleeping because of obstructive sleep apnea? Do a home sleep study. That's like almost routine in my clinic. Do a home sleep study. They're so simple and
Right.
inexpensive, that. find out if
Right.
you got sleep pathology, or just get in bed for 7.5, 8 hours. You're a hard worker, I'm a hard worker,
Yeah.
but you can't cheat Mother Nature if you're sleeping 4 or 5 hours a night, as you did during your residency, as I did for so many
Absolutely.
years. I don't do that
Yeah.
anymore. So,
Same.
good sleep hygiene and good sleep is key. So,
Yeah, fantastic list. There's a few devices that I recently came across. I don't know if you have as well. There's one called Zona. It's
mhm.
one where you apply isometric contraction from your hand. Supposedly that's helpful for high blood pressure. How do you feel about that one?
Yeah, it came from the astronauts in NASA, and they
Right.
found when they were in their seat and clenching on takeoff that actually their blood pressure seemed to be better controlled. So they developed a device. I'm all for it. It's one of the cool non-pharmaceutical ways to manage blood pressure. There's one called Respirate, which is more based on breathing and probably autonomic balance.
Uh-huh.
There's Heart Math, which is based on
Yes.
breathing and autonomic balance. These can all lower blood pressure and have actually pretty surprisingly strong cardiac data for health versus illness. And then there's
Yes.
even, you can train your diaphragm to be stronger. We think about training muscles. We never think about training our diaphragm. So
Right.
there is a few devices for about $80
Hmm.
that you can breathe, and 4 or 5 minutes a day. Actually, you can get a lower blood pressure in published research data.
Like an
Very
incentive
impressive.
spirometer type of device
Yeah,
or
Power Breathe.
power
Incentive
breathe? Okay.
spirometer is kind of the low end of it.
Got
Power
it.
Breathe, it's a UK device, but you can buy it all over the States. I have it
Okay.
across my room, so I had to take my glasses off. Have it sitting on as well. So
There's
these
something,
are
hey,
neat devices. Why take a pill if you can work with some, devices and lifestyle and sleep therapy and avoid pills? That's obviously a good
right.
goal.
Yeah, I usually give my patients first of all, you're absolutely right about getting a home blood pressure cuff. I can't
Yeah,
tell you how many patients I see that have ignored a high blood pressure reading at their primary care office for a decade because they attribute it to white coat syndrome. Someone didn't take it right, and they told, come back in a year and see me, we'll remeasure it. And they go decades without looking at their blood pressure. And I think we all know from the research that even a 10 milligram of mercury rise of blood pressure over 120/70 over the long term is deleterious, right? And so
right.
it's so important to know your blood pressure at home and measure it correctly and understand what it is. And so what I do, and tell me if you do something different, is I'll give many people a 3 to 6 month chance to try to manage it on their own at home. But usually I try to get them on some sort of combination therapy or therapy for their blood pressure with pills, with the agreement that our goal is to get off of these blood pressure medications over time. And we're going to do all of these things that you talk about. But I
Right.
think it's important not to live years and years with a blood pressure over 130, over 80, and just keep banging your head up against the wall trying to get it down without treatment. Do you agree with that? Or what is
Yeah.
your protocol use of blood pressure?
Again, I couldn't agree more. Although
Uh-huh.
people come to me, the holistic cardiologist, the functional cardiologist, I care about their heart, and I often make that negotiation. I always tell them these drugs are not for life guaranteed. They're for
Hmm.
life if we don't make progress, or you don't make changes, or you don't, if you don't work at it, we're going to
Right.
have to rely on some of these pills. But I hope that we can do it without, pills long term. I had that discussion with a gentleman today. I actually saw him 6 weeks ago, and I put him on a very odd herbal blood pressure pill. I'll just give you a tip called
Yeah.
Mukta Vadi. You buy it on Amazon. Mukta,
Hmm.
Mukta Vadi, Vati. It's got
Hmm.
ashwagandha and brahmi and some other herbal, and it works in like 90% of my patients. Very inexpensive. But I
Huh.
got his echo report back, and his echo showed quite a lot of thickening left ventricular hypertrophy, which really identifies a higher risk blood pressure patient. And I told him,
Uh-huh.
I'm going 6 months with meds. You got to lose 20 pounds. He's already lost 15. And we'll reevaluate the meds, but I can't afford to let you have
Right.
ongoing cardiac damage. I agree. It's that I told him it's the carrot at the end of the stick. Let's get you off meds, but you do your job, I'll do my job. And in the meantime, maximize the chance there's not going to be any cardiac damage. So I
Right.
agree with you.
Exactly. Yeah. And Dr. Kahn, we're talking a lot about cardiac damage, but what's great about what we're talking about is really attacking the root causes of all disease. So, when we're looking at high blood pressure, we're not just protecting your heart, we're protecting your brain from Alzheimer's, we're protecting your kidneys, we're protecting every organ that gets blood flow in your body, right? So,
Right.
we use the heart as an indicator of how our treatments are working because it's so important to protect our heart, of course, but you're just really promoting overall health.
Yeah, I agree. And, I'll throw out a controversial one. I don't
Sure.
like statin medication, but
Uh-huh.
this surgeon we talked about is the exception. My practice is full of 48 and 52-year-olds with very advanced silent heart disease on the calcium score, on the
Right.
CT angiogram, on the carotid study. I mean, they've got 30 years to get through life, 35 years without a bypass, without a stent, without a heart attack. And, one day we'll have gene therapy and CRISPR technology. But right now we got the tools we got. And, if I got to get their LDL to 40 or 50, which is the international guideline for advanced heart disease, I'll try like hell with supplements and diet and antioxidants. But, ultimately they need statins. And, although it's the word on the street that statin medication causes dementia, all the studies in the last 24 months say the opposite, that you are protecting a person's small and large vessels through their brain and the database. And again, statins are basically free nowadays. So it's not
Right.
a multi-billion dollar industry with
No.
generic statins. And I'm not pushing drug. I'd like it to be known I'm the
Yeah.
guy that tries to take you off drugs. But like you said, when you really care about the patient, you got to hit certain targets. And if I can do it with diet and fitness and supplements, fantastic. But the targets are tough nowadays. I mean, we really are pushing people's numbers down that have serious disease. Now, the good news is, like the surgeon, I see 52-year-old women that are on Lipitor. And I say, whoa, let's get a calcium score. Let's get a carotid. They have no disease.
Mhm.
We're
Off the
deprescribing. I
Lipitor.
love that word. We're taking
Right.
their drug away. So that's the flip side. Too many, premenopausal or menopausal women are on drugs they don't need, although they're at risk. Women are at risk. And I'm a big HRT fan. If you're going
Same.
through menopause, go get somebody expert like you.
Yes, I agree with that. And, I think a lot of women, when they go through menopause, their cholesterol goes up because
Yep.
of hormone deficiency. And then the knee jerk reaction of a primary care doctor is we got to put you on a statin. And really, they didn't need that in the first place. What they needed
Right.
was hormone replacement therapy. So it's super important. One device before we move on from high blood pressure that I'm really excited about is EECP. Have
How funny.
you seen this? And what do you
Yeah.
think about EECP?
Well, I bought the first machine in the state of Michigan in 1995.
Wow.
I had read some literature that they had. So there's a device that cardiologists use in the cath lab, super sick people, called a balloon pump. Oh, I
Right.
loved putting in balloon pumps. Big sheath in the groin, ba-boom, ba-boom, the whole room says, that guy's in charge. It's like a super macho testosterone thing.
Right.
But some Chinese investigators said if it works to rotate the blood internally with a balloon, can't we put trousers on the outside of a patient and go ba-boom, ba-boom, and circulate the blood? And they created this room-sized device. And then a researcher in upstate New York named Peter Cohn miniaturized it and published data, actually randomized studies, that angina goes away and nuclear stress tests got better, a 1,200 patient randomized study, and the FDA approved it. So I bought a machine in suburban Detroit, and we were the first to treat patients an hour a day, 5 days a week for 7 weeks. That was the protocol from China and New York. 35 sessions, quite expensive, $5,000-$6,000, but it was FDA approved. So you apply to insurance if you were having angina. Stuff works. Whether it builds collaterals, whether it improves endothelium, whether it lowers cardiac hormones, it has gone by the wayside due to stents, due to better pharmacotherapy, due to hopefully lifestyle therapy. But academic centers will still have it. I've always heard that Barry Gordy in LA, and actually John Sally in LA, the great 7-foot NBA star, used to talk to me forever. Let's put in a center in LA of EECP. And I've heard that Barry Gordy had a center just for wellness. And there are people trying to offer it for wellness. I don't know what it'll do for blood pressure, but it does improve endothelium. There are men that report improved sexual function. We hear about cold plunge, we hear about infrared sauna. You don't hear that much about EECP. The machines used to be $250,000. They're now about $50,000, so it's a little bit more accessible. And it's pretty safe, but you just don't hear that much about EECP anymore.
Yeah. So, I've seen some studies on blood pressure as well.
Yeah.
And I'm so excited about it. We're putting EECP in all of our Next Health offices, actually, and to use it for wellness.
Brilliant wellness step. Yeah.
Right. Yeah. So I'm super excited, and we're gonna have 30 locations all over the country. Hopefully Detroit as well. So we'll have we'll have some place to send people. Yeah. I'm excited about it because it is something that it's not a pharmaceutical that could be potentially very helpful. So we're gonna obviously be studying it as we
all
launch
those
it.
people with long COVID that have endothelial damage from the spike protein, go pump away. I mean,
exactly.
We're seeing a lot of spike protein damage in my clinic. Seriously.
Same. We're seeing a ton of, it's just mind blowing. And we're going to be learning so much about spike protein. Can we touch base on nitric oxide real quick? This is another very important topic that doesn't get enough airtime. Love to hear your perspective on nitric oxide.
Sure. So for those that may not know, there was this chase in the 1970s and 80s. What causes arteries to relax and dilate? And a chemical that had 3 different names around the world ultimately was found to be the same chemical, and the name was agreed upon to be NO, nitric oxide, 1 nitrogen, 1 oxygen. Those 3 researchers won the Nobel Prize in Medicine in 1998. And there's 100,000 articles about nitric oxide in the medical literature. The more you make, the more normal your blood pressure, the more normal your endothelium, the better your sexual health, the better your pulmonary function, the better your brain function. It's a signaling molecule made by the artery that goes right back and causes the artery to stay healthy. It only lasts for a couple seconds. So you can't get a nitric oxide blood level. It's too quick, which is the problem because 1998 was at 37 years later. We don't have a good test for it. You can buy these little test strips. I always have little test strips there, and you put your saliva, and if it turns bright pink, you've got a lot of nitric oxide in your saliva, which is a good thing. And if you're using Listerine and Scope or fluoride toothpaste, you kill that reaction. You can prove that. Your blood pressure may go down if you quit Listerine, Scope. I've got people that have Raynaud's, the cold, red, white, and blue. They stop Listerine and Scope. They make more nitric oxide. They can prove it. And their Raynaud's goes away. It's the most fascinating thing. Brush your teeth, floss, water pick, but maybe not use antibacterial mouth treatments if you don't need them. There's a blood test called ADMA, asymmetric dimethylarginine. It competes with nitric oxide, and if it's high, your nitric oxide production is low. But all we can do is all the good things. All the good things should make more nitric oxide. The exercise, the monitor your blood pressure, the eating leafy greens, eating beets, eating watermelon, eating pine nuts and others. They all contribute to nitric oxide production. That's why there's so many beetroot powder, chewies, and powders that are on the market. I'm not a big fan of any of them, but some athletes have found that certain beetroot powders, red spinach is a major dietary nitrate contributor, and you can get capsules with red spinach or powders with red spinach. There's no oxalates in red spinach, so you don't have to worry about kidney stones. Kind of a cool little tip. And of course, indirectly, Viagra and Cialis, now generic, they work by maintaining your nitric oxide in your blood for longer duration. They block the enzyme that degrades it, or degrades cyclic GMP. But if you're not making enough, those drugs aren't going to work. That's why some guys try those drugs and they don't have much of a response because their vessels are so damaged or their lifestyle so altered, they're just not making nitric oxide. So you don't have any around to prolong its activity level. So it would be a huge breakthrough if we could test it better. There are some interesting lozenges, and if you don't know Nathan Bryan, PhD, but you might know him, he's sort of the king of nitric oxide. He's got a new book out. He'd be a great person to interview. Very dear friend, and he makes a nitric oxide lozenge called N101, which is what I go to when I need a lozenge. It's a very interesting breakthrough in nitric oxide support.
Oh, I'd love to interview on one of these days because I'm very interested in the topic. Fantastic. And then let's talk a little bit about, I'm a big believer in empowering our patients, right? And one of the ways I try to empower my patients is to educate them on the biomarkers that they should be following for themselves, because no one's going to care more about your health than you do, right? Even Dr.
Correct.
Kahn or Dr. Shah that really wants to see you be healthy. We just don't have the bandwidth to monitor every patient's biomarkers every single day. And so I would like to empower my patients by telling them these are the 2 or 3 things that you need to follow so you understand the status of your cardiac status. And so to me, I tell everyone they need to know what their LPA is. They need to check it one time, make sure it's not high. I'm a big believer in just giving them one number now, ApoB, to follow. What are your thoughts around ApoB?
Yeah, if you actually had to pick one, people get the full page cholesterol panel.
Yeah, they're so
and
confusing to
things are
people.
yellow, red, green. That one number, ApoB, does count all the bad particles in one number. Now, if you have inherited lipoprotein A, it'll be there. If you just have lifestyle or genetic cholesterol, it'll be there. So I agree. And, most recent data published 3 weeks ago from the UK Biobank said, it's all about ApoB, but that's a 40-year-old marker. I mean, I co-lectured with Thomas Dayspring, one of the country's leading cholesterol experts, 40 years ago, and he was screaming, check ApoB. So again, us doctors are so slow to incorporate new ideas, and it's, a $25 blood test. So if we just tracked ApoB, you're dropping it from 130 to 110 to 90, and a lot of people are well under 60 nowadays, which is kind of a nice sweet spot for arteries.
Right. Fantastic.
And the thing is, everybody's screaming you need cholesterol for your brain. I don't hear anybody screaming you need ApoB for your brain. So we're going to get a couple years of peace and quiet from the cholesterol deniers.
Oh my gosh. The arguments are so ludicrous on social media about cholesterol. It just doesn't make any sense to me sometimes.
Thank you for saying that, because I'm so exhausted by fighting the deniers, and I've done it for so many decades.
Right. And I'm sure you also face a lot of controversial statements around your diet choice, being a vegan. And, my talk track with my patients is, look, I really don't care if you eat meat or not, but if you are going to eat meat, the saturated fat for most people will cause long-term problems for you. And then we talked about a lot of different ways, not just increasing cholesterol, but also increasing inflammation. And I think that's a really important way to kind of frame this. And also I see vegans that are super unhealthy because their diet is mostly horrific processed carbohydrates. So, I'd love to hear how you talk to your patients about their diet.
Yeah, and I agree. I've had the opportunity to be on Rogan and debate diet with a pro-paleo, and I've been on the doctor's show and debated Paul Saladino, carnivore, paleo, keto. And, I try and have reasonable conversations with people. Obviously, everybody agrees and, get rid of highly processed, fast food, frozen food, chemical rich, the very conversation going on in Washington, D.C., thank goodness. And we got to start with the kids and the school lunches because they're the most vulnerable, but it's important for us too. Then the question is, if your plate is full of fruits and vegetables and a small portion of your protein of choice, I love the term, my protein of choice may be tofu and yours is chicken or grass-fed beef or salmon or something. I mean, it's a pretty small debate at that point.
Right.
All carnivore, I recognize there's some amazing clinical responses, reported, not in the medical literature. There's so little medical literature, but,
right.
And I believe, Michaela Peterson probably did get better with a carnivore diet. God bless her. So I'm happy for her. But I agree. Just get rid of crap. I mean, there's too much crap everywhere. And, doctors eat crap nonstop. I walk up and down the hall of my medical building at lunchtime just to move a little bit. And I can look in the lunchroom of the endocrinology group, and they're eating crap that the rep brought in.
Oh, my God. Krispy Kreme, right?
We're all so susceptible and weak, and you just can't have it in my house. I just can't have it around. So get rid of crap would be a great start.
I love it. I love it. Well, Dr. Kahn, this has been such a fantastic conversation. I know you have patience. I am so coming up here right after this talk, and I'm so appreciative that you took some time out of your busy schedule to talk to me and my audience. You're one of the most innovative and exceptional cardiologists that I've ever met. And, I read your book 10 years ago, The Whole Heart Solution. I suggest everyone read that book. It's an easy read, and it's not just about your heart. It's about just overall health. And Dr. Kahn, when's your next book coming out, and what's it going to be called?
Yeah, it's called The War on Heart Attacks. It's going to be thick. It's going to have all my secrets. I hope to be practicing for about another 10 years, but it's time to just share everything. It's a pretty, like, if you know the term red ocean, blue ocean, preventive cardiology is a pretty blue ocean. There's not a lot of people talking, writing, social media. So I feel an obligation to, kind of write a big book, hopefully grab a good publisher. So it'll be 2026. Thank you.
Thank you. I can't wait to have you back on to talk about that book as well, if you don't mind.
You betcha. Thank you so much.
Thank you so much, Dr. Kahn. Until next time, you take care.
Bye-bye.